Hello everyone, this is Dr. Akash Chaudhary, MD DM Gastroenterology. I'm a senior consultant gastroenterology, hepatology and advanced therapeutic endoscopist at Yashoda Hospitals, Hyderabad. Today's topic for discussion is GI bleed. It is a very commonly found symptom. We see that patients come with either blood vomiting or passing backward motion. So what are the different definitions used are hematemesis, that is called vomiting of blood, is called hematemesis. When patient passes black color stools, it is called melena, and sometimes when there is fresh blood after passing motion or before passing motion with pain, it is called bleeding per rectum. And sometimes frank blood per rectum is called hematochezia. So these are the different conditions. Bleeding is defined as upper GI bleed and lower GI bleed. So anything which is above the ligament of treats, which is an anatomical mark, is called upper GI bleed. Anything below that is called as lower GI bleed. Mostly in upper GI bleed, the presentation is either you have a coffee ground vomiting or you present with black color stools and can be associated with pain in the stomach. Lower GI bleed, mostly they present as fresh blood per rectum, or it can be a maroon blood, and they can be with pain or painless. Then again, there is overt bleed and occult bleed. Overt bleed means that these symptoms will be seen, these features will be present, there can be blood, there can be black motion or bleeding per rectum, which we can see is called an overt bleed. And occult bleed is that patient is losing blood from the GIT, which can be done by a stool, detected by a stool test, but with the eye we cannot see that there is active bleeding. Mostly patients with occult bleeding will present with lightheadedness, dizziness, stomach pain, and some amount of chest pain. They can also present with shock, in which there will be fall in the blood pressure and increase in the heart rate. So these can be some of the presentations which will not be very sudden, but will gradually lead to anemia, and because of this occult blood loss. Now, what are the most common causes of upper GI bleed? The most common causes of upper GI bleed are peptic ulcer disease, which can be a duodenal ulcer or a gastric ulcer. It can be due to variceal bleed, esophageal varices or gastric varices in those patients who have underlying liver disease or portal hypertension, and patients with esophagitis. These are the most common causes of upper GI bleed. Lower GI bleed, most common causes are, it can be due to diverticulitis, it can be due to colonic polyps, it can be due to hemorrhoids, growth in the colon, it can be either anal fissure. So these are some of the common causes for lower GI bleed. Now, how do we diagnose or investigate is that we do a complete blood picture, see if the patient is losing blood from the GIT. We do an upper GI endoscopy, and if it is bleeding, we try to control the bleed endoscopically, and a colonoscopy is done. So these are the conditions. So when should you meet your doctor? That if you are having persistent, either you present with overt blood vomiting or black color motion or bleeding per rectum, or if you are having generalized weakness and you get your shortness of breath on exertion, and you get your blood test done and shows low hemoglobin, please consult your gastroenterologist. For more updates in gastroenterology, like, share and subscribe the channel. Thank you.